Good afternoon, and thank you for joining us here today. As we announce what in some ways is another tool that we are putting in our toolkit to handle and deal with the opiate epidemic, which of course is not only having a tremendous impact in this community, but in some ways across the entire nation. You've heard me speak many times before on the efforts that we are taking locally to help individuals who are addicted to opiate-based drugs, as well as to prevent others from being addicted to opiate-based drugs. But we've never really discussed what caused it and how Erie County can take an action against those who helped create this epidemic. But that's what we're here to do today. Is yesterday, as most of you know, Erie County filed a lawsuit in the state Supreme Court of the state of New York here in the county of Erie against 11 pharmaceutical manufacturers and 4 doctors for their role in creating and promoting opiate-based drugs as being a safe alternative and a non-addictive alternative for pain management. And we know, as I've said before, that the gateway to opiate epidemic, including those many who are using heroin and fentanyl today, are drugs they were legally prescribed by their doctors, and their doctors were told for many years in a row that these drugs were not addictive, as well as were not deadly. And we know that is not the case today. So joining me here today, as you will see from my left to right, of course, is our Commissioner of Mental Health, Michael Rainey, who's intimately involved in issues associated with the treatment of individuals who have addictions, not just opiate-based addictions, but any type of addiction, and has been actively involved with the local treatment providers in trying to find access to beds as well as care for individuals who suffer from addictions. As well as to my left, I have our Health Commissioner, Dr. Gail Burstein, who is intimately involved as well with the issues associated with the opiate epidemic, and the two of these individuals co-chair our local task force with regards to the opiate epidemic. To my right, of course, is our Erie County Attorney, Michael Saragusa, who spoke to me last year about what actions Erie County could take to go after those who created this epidemic. As a result, we're here today with this lawsuit that I have in hand that was filed yesterday. That is the work of Paul J. Hanley of Simmons Hanley Conroy LLC, a law firm that is truthfully a complex plaintiffs litigation firm that has dealt in many different complex litigations over the years, including being one of the lead law firms to deal and to take on big pharmaceutical companies that have been at the heart of the opiate epidemic. I do not take this lightly. Suing some of the largest pharmaceutical companies in the world is not something that you always take as something that's easy to do, but what you need to do is do what's in the right interest of the greater community. And that's why we all stand here today. Because we need to hold those accountable who created this crisis in our country, that created this crisis in Erie County. And as I've said many times before, the gateway drug to most of the individuals who are suffering from an opiate-based addiction are drugs that were legally prescribed to them, and for many years were claimed to be safe pain management alternatives that were non-addictive. And we know now that is not the case. So we are taking action here in Erie County against 11 drug manufacturers who have made a varying number of drugs, as all named in the lawsuit. Some of the biggest names that you will recognize in the pharmaceutical industry, such as Purdue Pharma, Johnson & Johnson, McNeil, Janssen, Janssen Pharmaceuticals, because for decades they peddled these drugs as if it was as safe as taking a piece of candy, that they would solve the pain issues of an individual, and that doctors would not have to worry about the long-term effects of these drugs. And they hired doctors to go around the country to talk to other doctors at medical conferences and one-on-one conversations, to be in some ways their paid spokesman, so that they could go around and doctors could hear from other doctors about the wonder drugs that were these opiate-based drugs and how safe they were, and they were non-addictive. Well, we know that is not the case, and we know that these companies have known it for some time as well, yet they still peddled these drugs on the market. I look at it that we need to hold those accountable who've created this crisis, whether it's a large pharmaceutical company or it's a drug dealer on the corner. They all need to be held accountable for the actions that they've taken that have destroyed lives, We know what's happened here in Erie County. On average, we were having approximately 100 deaths a year up until 2014, in which roughly 1/3 of those, we believe, of those 100 deaths a year from overdoses of opiates were based on prescription drug overdoses. And then the numbers really started to skyrocket, as we saw more than 200 deaths in 2015. And based on the estimates that we have right now, from 2016, we believe we'll end up with approximately 320 to 325 deaths in 2016 once the final toxicology reports are completed. And I'm sad to say, for 2017, we've been averaging more than 1 death per day in Erie County as a result of the opiate epidemic. These are estimates because we don't have, of course, toxicology reports, but based on the information that we have, we actually have more than one. It's about 1.3, 40, how many?
43.
43 deaths, we believe, in Erie County since January 1st, and here we are, it's February 2nd, as a result of what we believe are opiate overdoses. Many of those overdoses are heroin and fentanyl, but the individuals who are dying as a result of heroin and fentanyl first became addicted to drugs because of opiate-based drugs. It's as simple as that. We need to take action, whether it's the drug dealer on the corner or it's a big pharmaceutical company elsewhere in this country, because they are all culpable. They are all liable for the crisis that they've created, not just here in Erie County, but across the entire United States. So that is why I am very pleased that while we're not the first in New York State, as Suffolk County was the first to file a lawsuit, we joined Suffolk County in going after big pharmaceutical companies and the doctors that push these drugs, that are just as culpable as the drug dealer on the corner, because they need to be held responsible for the costs that have been incurred by our county in dealing with this healthcare crisis. And we need to let the public know that we will not let those responsible get away with what in many ways is murder. It's as simple as that, folks. And that's why I'm very proud that we were able to file this lawsuit yesterday. With that, I'd like to turn it over to Mike Saragusa to talk a little bit about the suit and to introduce Paul and what we expect going forward from here. Michael?
Thank you. I think the county executive summarized the crux of the claim well. Nobody can deny the epidemic that's present in Erie County and the country. So yesterday we did file a lawsuit, six causes of action against 11 pharmaceutical manufacturers, 4 doctors, who we believe were involved in a scheme to misrepresent the effects of opiate use for long-term chronic pain management. They did that to profit, and the profits were enormous. So back in September of 2016, we got wind of a suit brought on behalf of Suffolk County by the firm of Simmons, Hanley, and Conroy. And at that point, we reached out to Mr. Paul Hanley, who's here today with us, and began assisting them in preparing a complaint, 75-page complaint against these manufacturers and doctors who engaged in the scheme to promote the use of opioids by utilizing misrepresentations as to their long-term effects and the addictive nature of these drugs. The firm of Simmons, Hanley, and Conroy has been engaged in this type of work before. They've sued these manufacturers, or I guess one of these main manufacturers, on behalf of approximately 5,000 individuals that had been addicted to opioids in the past. They know these companies, and the discovery they obtained in that case was subpoenaed by the United States Department of Justice, and they used those documents to obtain I believe approximately $692 million criminal penalty against them. So this firm, I'm very confident, has the ability and resources to go against these large pharmaceutical companies. We know they will come after us aggressively. They will try and have the suit dismissed. Some of the top law firms in the country are going to be involved. I've worked in big firms before. I was down in Philadelphia in a 200-member firm. I know what we're up against, but I'm confident in the ability and the resources that the Simmons, Hanley, Conroy law firm has. They're one of the largest plaintiffs firms in the country. They have approximately 225 employees. They have 75 lawyers, They know what they're doing, they know this area. The claims that we've brought against these manufacturers and doctors, if I can just briefly go over them. Deceptive acts and practices under the New York State business law, false advertising under New York State business law, public nuisance, unjust enrichment, violations of social services law, as well as fraud. We know it's going to be a long process. It's going to be an expensive process. The costs are going to be incurred by the law firm. There's no risk to Erie County in the event the suit is not successful. In the event it is, and those costs and fees would come out of any settlement. So there would be no out-of-pocket to Erie County or its residents. I'd like to turn it over to Mr. Hanley, if he has any comments on the merits of the case, and go from there.
Thank you. Thank you, Mr. Saragusa, and thank you for engaging our law firm on this matter. I'm very proud to be here representing the county. As Mr. Pollenkart's indicated, the county has suffered terribly from this epidemic, and we believe, my law firm believes, that we have the ability to bring justice to Erie County and its residents as against these companies who, since 1994, have been engaged in a scheme to defraud the public, to defraud physicians, and to defraud municipal entities such as Erie County with respect to the allegedly non-addictive characteristics of these drugs. These drugs are highly addictive. They have always been known to be highly addictive, and the pharmaceutical manufacturers engaged, as Mr. Saragusa said, in a massive fraud, indeed a conspiracy, much like the tobacco companies did for many decades. So we have been down this road against these companies many times before, in particular against Purdue Pharma with respect to the 5,000 individuals that Mr. Saragusa indicated that we represented. So we are very knowledgeable in this area. We have some very smart lawyers in our firm, myself excluded, and we have the great good fortune of the financial resources to bring this matter without any cost whatsoever, any financial cost to the County of Erie. So I'm grateful for being here, and I am committed to achieving a substantial measure of justice for Erie County.
Thank you, Paul. As I said, we do not take this measure lightly, but we think it had to be done. It is stating on behalf of the people of Erie County that we will not let those who are responsible for this epidemic go how shall I say, go without justice to the people who are no longer with us, and ensure that the people of Erie County are justly compensated for the costs that they've had to incur over the years to deal with this terrible crisis. With that, I'd be glad to open up to any questions.
What is the monetary damages you're seeking in the suit?
Monetary damages have not been identified at this point in the complaint. They will be identified as the suit goes along. There's a lot of work that has to be done by Paul's firm to quantify the information that we'll be providing them as to the amount of money that the county has expended, other resources that have been utilized. But as of right now, there is no exact amount, though it's fair to say we are talking about tens of millions of dollars.
Are you trying to shut these companies down? Are you trying to figure out and at least get back everything the county has spent? Medicaid, or must have spent a lot of money. I mean, what are you trying to accomplish by doing it?
Well, first off, we're trying to prevent them from being unjustly enriched for their deceptive practices. It's as simple as that. If you engage in deceptive practices that harm the public, you should not be unjustly enriched as a result of it. So we would like to go after the profits that they were able to receive as a result of the work that they did here in Erie County through their deceptive practices. We also want to send a message that this is not tolerated in our society, that a pharmaceutical company or doctors can go out there and push a product that they know is harmful and state that it isn't, and then create what we see in this community, which are thousands of individuals addicted, hundreds of people dying on an annual basis. Just like the tobacco suits, where the tobacco companies fought it for many years and would never admit that tobacco was harmful, then finally they did. And their own internal report showed that it was harmful. This is the same situation here. We want to recoup the costs that the county incurred. We do want the pharmaceutical companies to know that we will not tolerate them taking advantage of our population. They need to be penalized for what they did. They're unjust enrichment, so to speak, and we're also seeking treble damages as a result of that, so that the pharmaceutical companies know in the future, if they're going to be peddling a product and they're claiming it's safe, it better be safe. If they're claiming that the product is non-addictive, it better be non-addictive. Otherwise, they can be held responsible for it.
Are there any local doctors or companies named in the suit?
No. There's New York doctors, but I don't believe there's any.
One New York.
Yeah, one New York doctor, but none from Erie County. The companies themselves are not based in Erie County. They're based all across the United States. There's one doctor in New York. There are 3 other doctors from across the United States who are actively involved as what can only be described as paid spokesmen, knowing what these pills could do, advocating on their behalf for the pharmaceutical companies, even though as a doctor they really should have been out there saying, well, these really are harmful. So, but there's no one local.
Why not take it to a grand jury?
This is not a criminal case.
I know,
It's
I know,
not a
but
criminal
if
case,
it's,
Michael?
if they did what you're saying, I would think this is,
Well, that's
you're a
what-
lawyer, he's a lawyer, the violation of criminal law.
You don't take civil cases to grand juries. And I think it's fair to say that what we're looking for is justice, not from the sense of putting somebody behind bars, but justice for the actions that were taken, because we're talking about large-scale pharmaceutical companies that are owned by shareholders all around the world. We need to show them, and usually the only way to show them is in their pocketbooks, in their bottom line, in their financial statements, that what they did was wrong. And I can tell you that as being a former controller. I know when you go after the bottom line of a company, that's when it gets their attention. If you go after some low-level doctor, if you go after some chemist or a PR person and you actually were able to convict them, that's not hurting the companies that reaped billions of dollars in profit. And the only way to go after them who've reaped billions of dollars in profit is to go after the bottom line, not some low-level chemist or PR person who pushed it.
Quite often you see companies just settle out of court for a large sum of money without admitting any guilt. I mean, is the county going to be satisfied if that's the outcome?
Let's just put it this way, I will leave it up to Mr. Hanley and his firm to discuss the strategy as we go forward. I do know, as an attorney myself, all the options that are available, but I'm not leaving anything off the table at this point.
Has the county ever taken a civil suit to this magnitude?
The county was involved, of course, in the civil suit against tobacco settlement, in the tobacco settlement case years ago. The Gorski administration took suit, and it was part of the comprehensive judgment, and during that time period actually received a substantial settlement, which was eventually securitized for a $250 million payment back in the 1990s or early 2000s. So the county has been actively involved in these types of suits in the past. As Mr. Saragusa said, we fully expect each one of these pharmaceutical companies and the doctors to be armed at the teeth with some of the highest paid attorneys, defense attorneys in the country. So we fully expect them to be fighting this, but we know we're on the right side.
For the lawyer here, can you stand in front of the microphone? I would imagine what you want is what happened in the asbestos cases, in some of these other chemical cases, in tobacco. You want discovery of their inner records, of what they knew and when they did.
Yes, that is correct, and in fact, in the earlier litigation in which my firm was involved, which Mr. Saragusa mentioned, we obtained very substantial discovery from one of the defendants in this litigation, the Purdue group of companies. And the United States Department of Justice got wind of what we were doing and actually subpoenaed me and my law firm for those documents, which Justice then used to secure criminal convictions against Purdue and certain of its executives. and a $692 million penalty. So whether that will be repeated in this litigation, I have no idea, but you're absolutely correct that we're going to be seeking millions of pages of documents from these companies relating to their marketing practices, relating to the alleged science that underscored these claims of non-addictiveness, because we know that there was no such science. And so we're going to be looking for all of that. And whether Justice or Erie County District Attorney or some other law enforcement person comes forward and wants the benefits of that discovery, well, we'll just have to wait and see when the time comes.
Are you talking 10 years from now? I mean, these cases are notorious for taking forever.
Well, I can't say how long this litigation will take. I will tell you that the prior litigation, which resulted in a $75 million settlement, was resolved in just a little over 3 years. But I can't make any prediction.
The pharmaceutical companies will say that their own product literature states that their drugs can be addictive, lead to overdose and death. So, I mean, if they're saying that they have this, they're being very transparent in stating that these are possible outcomes, how do you intend to fight that argument?
Excuse me. They made the same arguments in the Purdue companies made the same arguments in the prior litigation. And while there are references in certain of the product literature to addictiveness, what these companies did was they essentially went to doctors, to prescribing physicians, and said, oh, don't worry about that fine print. Here's information that indicates that if properly administered, these drugs are not addictive. So they essentially tried to undercut the statements in certain of the product literature by blaming FDA, by saying, oh, FDA makes us say that, but actually these products are not addictive. And this was a pattern that went on for many years.
Any additional questions?
Dr. Burstein, can you
Sure.
stand to the mic? Have you ever been in a conversation before you became health commissioner or anything like that where one of these companies, doctors would tell you, you know, it's you just have to be careful sort of question?
Relating to prescription pain medication
Yeah.
or any medication?
Let's just take prescription pain medication.
Well, fortunately, pediatricians are not commonly prescribing prescription pain medication. And so where I worked, I really never had those conversations with pharmaceutical companies regarding prescription pain medications. I mean, however, we know that every pharmaceutical company has to list all the potential side effects that may have been associated with the people in the studies that the trials that were used to receive FDA approval, and whether those symptoms were direct cause and effect of the medication, or they were maybe just temporarily associated, say taking an antibiotic during cold season and then they reported having a runny nose. Is that cause and effect or temporarily associated? So those data are a little bit more complicated, but again, hopefully physicians can use science and can common sense to really be able to discern that. However, any serious side effects such as addiction or overdose, I think physicians would need to take very seriously, as opposed to say, a sore throat or a runny nose. So again, it is complicated. But fortunately in pediatrics, we don't have to deal much with prescription pain medication, and just in terms of general primary care. But we do have to look at the fine print for all types of medication.
Thank you. Pat?
And just at this point, do you need any doctors to come forward here in Erie County? Are you reaching out to the medical folks to come forward if they have evidence that they were approached?
I believe going forward, it will be a discussion initially between Stanley's firm and the county, and as it goes forward, I'm sure we'll be asking for more information with regards to patients who are prescribed, as well as potentially talking to doctors. But this is going to be a long process. We're not asking for people to call us immediately. We don't want that to be the thought. We actually do, unfortunately, know a lot of folks who've dealt with these issues. Actually, I'm joined by Erie County resident Judge Smith, who lost her son Nathaniel as a result of this. So it's not like we don't know who a lot of these individuals who were directly affected are. We do. Many of them, like Deb, actually are on our task force to try to prevent what happened to her son happening to others. But for the time being, our goal is to go through the records of the county, provide that information to Paul's firm, and then as time goes by, when they seek additional information as necessary, we'll be there to help them.
Your records, just Medicaid records, show who's prescribing this stuff. I mean, is it a very small number of doctors who are going to get invited in to discuss their prescription practices?
I will say this, we know in Erie County through the Medicaid records that millions of pills have been prescribed on an annual basis. And as you've heard me say multiple times over during, we've done our analysis from the Medicaid Inspector General's office, and the #1 prescribed drug for approximately 7 years in a row was OxyContin hydrocodone. It is now #3, thankfully, because of the education we've been able to have with prescribers to know that the dangers of that drug. But we know through our Medicaid Inspector General, at least as long as it's been in existence, exactly how many pills have been prescribed and who received them. Those are just Medicaid recipients. Of course, we don't know private pay, but when I talk to the health insurance companies and I tell them that OxyContin hydrocodone is the #1 prescribed drug for Medicaid recipients over these years, is that, can you tell us yours? And they'll say, well, I can't tell you it's ours, but your numbers don't surprise us, which is their way of saying, yeah, it's probably #1. So I would say that they're, based on what was prescribed to Medicaid patients in Erie County, it wouldn't shock me if on an annual basis more than 10 million pills of these related drugs were prescribed annually. And we've actually been able to lessen that compared to what it used to be. So who knows what it would have been like 10, 15 years ago.
You're clearly trying to do this to help, and to stave off, a deadly problem. There will be critics that say, is this the way to do it? Any drug abused can be problematic. I mean, what do you say to those critics?
Well, what I would say, Tim, is that if the pharmaceutical companies and the doctors that originally were pushing the prescriptions went out there and said, these are highly addictive and could be deadly, we wouldn't be here today, but that's not what they did. They were going out there and saying, no, these are not addictive. And these are the wonder drug for pain medication, in which your patient will take the drug, their pain will go away, and there's no side effects, and in the long run, everyone will be happy, which we know is not the case. Before you walked in, I said we need to treat everyone who's responsible, everyone who's culpable for creating this opiate epidemic crisis the same, whether it's the drug dealer on the corner who's selling pills individually or pushing little packets of heroin, or big pharmaceutical companies like the ones that we're taking to court, because they are just as culpable as the low-level drug dealer on the corner, because what they were pushing were highly addictive and very dangerous medications, not just on the people of Erie County, but on the world, saying they were not. And they cannot take advantage of that. They should not be unjustly enriched because of their deception. If they had actually gone out there and said these are highly addictive, that there is serious side effects including death, and we expect that from people who take these over a certain time period, we may be in a different situation, but we're not, because they didn't act that way. They treated it the other way, which is these are as safe as taking a piece of candy.
I have a follow-up question for Mr. Hanley. Aside from Erie County and Suffolk County, do you know if there are any other counties that are working with your firm, could be filing similar suits or have filed similar suits to the one Erie County is filing?
Yes, yesterday we filed on behalf of Broome County in addition to Erie County. And as you know, we filed on behalf of Suffolk County, I guess 3 or 4 months ago. We have been in discussions with a number of other counties, and frankly, I think given the breadth of this problem, I would be very surprised if at some point or another we are not contacted, if not hired, by virtually all of the 62 counties in the state.
If there are no further questions, I thank everyone for being here, and as I said, this is just another tool in our tool belt to deal with the opiate epidemic. to fight it every way we possibly can, and we will do our best to ensure that we do end this epidemic. Thanks, everyone.